Good morning, people. It's early morning, I've been to the toilet, and on wiping myself, I found some blood on the toilet paper, and there is blood also in the toilet itself. What should I do? Should I worry? Should I be concerned? Should I speak to anyone? In other terms, what is the best course of action? Generally speaking, a bleeding from the back passage means that there is a source of bleeding in the bowel. And usually it is the large bowel, which is the last part of the whole gastrointestinal tube. A bright red bleeding usually comes from the very tail end, which means rectum and anus. If the blood is towards the dark side and is mixed with the feces, probably comes from the proximal part of the large bowel. If the blood is totally black, it means that it's coming from the upper gastrointestinal tract. It is important also to evaluate the other symptoms. Is there any tummy ache, anal or perianal pain? Did my bowel habits change in the last few weeks or months? How's my appetite? Did I lose any weight? All these informations are very, very important for the healthcare providers to give you a sensible option and to guide you into the diagnosis and treatment process. My suggestion is every time you see blood coming out from your back passage, whatever the color, whatever the other symptoms are, go to your GP or go straight to secondary care, to the specialist, to be investigated and, in case, treated. The first investigation in these cases is usually a physical examination. GP or the specialist will touch your tummy. They may need to see your back passage. Next step will be an endoscopy. With the term of endoscopy, we indicate a camera examination of the inside of your body. So it's quite a general term. An endoscopy through your mouth is called gastroscopy because we go and examine your gullet, stomach, and duodenum. An endoscopy through the back passage can be a full colonoscopy, meaning that we are going to investigate the whole large bowel, or a limited colonoscopy or flexible sigmoidoscopy, which allow us the examination of the rectum, sigmoid, and descending colon. Depending on the clinical situation and the preference of the specialist, you may need a full colonoscopy or a limited colonoscopy. If the bleeding is bright red, maybe a flexible sigmoidoscopy is sufficient. If the bleeding is dark red or is mixed with the feces, probably is better to investigate the whole large bowel. Through the colonoscopy, we should be able to identify the source of bleeding. The most common source of bright red bleeding, in particular if associated with the perianal discomfort, is hemorrhoids or other anal disease like a fissure or fistula or an inflammation of the anus and rectum, the so-called proctitis. It is also possible to have bleeding from polyps or cancers of the tail end. A dark red bleeding, in particular if the blood is mixed with feces, usually comes from the proximal part of the large bowel. That can be due to an inflammation of the bowel, a colitis, can be due to diverticula of the bowel, or can be due to a polyp or even a tumor of the bowel, or can be something coming from the small bowel, such as a polyp or an inflammation, or even something coming from the upper GI tract, such as an ulcer of the stomach or the duodenum. An endoscopy will tell us the precise diagnosis. Now let me tell you something about the colonoscopy. Colonoscopy is an invasive procedure. We use a very long tube with a camera on the tip of it, We'll go into your back passage all the way around, see the whole large bowel. When we're inside with the camera, we need to inflate your bowel with gas in order to dilate the bowel, be able to see the walls of the bowel, and create the space to go through with the camera. This dilatation of the bowel, this gas in the bowel, can give you some sort of crampy pain, trapped wind pain, but this can be very easily tolerated with a bit of sedation. Sedation is in the form of intravenous injection or just a bit of gas. People needing complete, full anesthesia or deep sedation are very, very rare. During the colonoscopy, we can in case remove polyps or take biopsy or just taking a lot of pictures to demonstrate the diagnosis. Sometimes colonoscopy is not sufficient and we may need to do some other investigation to have the wide picture, such as a CT scan or an MRI. After the colonoscopy, you will have a chat with your surgeon or your gastroenterologist or even your GP to establish, to decide the next step, which is usually the treatment. It will be up to your consultant, your GP, and yourself to decide the best course of action. In conclusion, the take-home message is, if you see blood coming out from yourself, please listen to your body, go to your GP, go and see a secondary care specialist either in the NHS or in the private sector, because it's much better safe than sorry.